Hey guys, welcome back to our channel. Hey, today we're going to talk to you a little bit about the therapeutic benefits of Kinesio Tape and some of the common terminology that we're going to be using in our Kinesio Taping series of videos that are on our channel. I like to use Kinesio Tape to facilitate or inhibit muscles with our athletes or just patients in general in our physical therapy clinic. The majority of the time we're using it to facilitate the muscles so that we can get those athletes back on the field so that they can perform at their highest level. So I like to buy Kinesio Tape by the roll because you can customize your cuts. There's nothing wrong with pre-cuts. However, pre-cuts are pretty limiting on some of the areas that you can use them on based on the size of the pre-cuts. When you have the roll, all you need is a pair of scissors and you can customize your cutting of the tape to whatever specific body part that you're taping. Now, I like to round the edges so that those corners don't catch on clothing or material when you're getting dressed. So I always try to round every edge so that it gives it a smoother feel and you're not peeling that up. If the tape does start to peel up on you, you can just cut the edges down and go. So this is just a piece of tape that I just cut, and what we're going to consider this whole piece of tape, as we tape, you're going to have an anchor point, and we typically will just kind of tear the tabs on that because this tape stretches. The anchor points are starting at the beginning of the tape. So when we're doing this to facilitate a muscle, we're going to start this where the muscle originates from. And we're going to apply the anchor with no tension. Then as we apply the tape, we're going to stretch that tape 15 to about 35 or 40% throughout the base area, or that same area can be called the therapeutic area. It's over the muscle that's involved. And then these tabs at the end, we can tear these tabs. And these tabs are anchor points that can have a little bit of tension on them, but you want to leave about the last inch or so of each tape, what we call the ends or the tabs that have no tension on them. So when we're applying Kinesio Tape, the top portion of the tape that's being applied is the anchor with no tension. The therapeutic zone or the base of the tape has a stretch of between 15 and sometimes up to 50%. Your tabs put that same tension, 15 to up to 50%, and then the anchors or the ends at the bottom have no tension on them. So the therapeutic zone has the tension, and you have anchors at both ends so that the tape is being adhered to. You can cut these to fit any type, and usually most of the good Kinesio Tape rolls have grids on the back so you can measure them to get them pretty good. And then, like I said, always look for Kinesio Tape that has a fingerprint technology on them. Not all tapes have this, but you want that fingerprint looking technology on the tape so that it gets maximal adhesion to the affected area and it can move with you.